Hello, my friends. This is Pwalpar. I'm sitting in the car today. We're sitting out in front of Target at a shopping mall. My viewers will recall back in the summer when I went and got me prescription glasses. I had a big trouble getting them to match my eyes. The eye doctor should have caught it then that something was wrong with me. But I never did quite get them glasses right. But it turns out I got a thyroid eye disease, which is a side effect of having hyperthyroidism. Kind I got it can make you blind, and what's it called? Graves' disease. Anyway, I went to the eye doctor a second time after I realized my glasses were doing me no good, and I'm starting to see double. I'm seeing two of everything here, unless I'm looking right down in front of me. I can see single there. I need to check my eyes again. I told you last time I was seeing double. Well, he sent me to his son, who's a specialist. He does the surgeon and stuff. The two doctors work together in there. He thought I had lymphoma. They sent me off to be scanned, did ultra scan, or whatever you call it. They lay you on a machine and scan your whole head, and it showed there was some thickness behind my eyes, and, well, maybe you got a problem. We're going to line you up for a biopsy to see if you got lymphoma. That was around the end of December when I quit YouTubing. Well, the very next day, was a Tuesday, I guess, I was supposed to go into surgery. My wife and I came down with the worst case of flu you ever seen. I couldn't even get out of bed. So for a week or two there, we were pretty sick with the flu. That surgery got canceled. Went back to the doctor. He lined me up for a later time on the surgery. In the meantime, he had me on prednisone and some other kind of medication. That makes you kind of dizzy and lightheaded. Finally got around to having my eye surgery and went into the operating room there here. It's not been too long ago. I woke up in the operating room, in the recovery room, and I asked him, well, is it lymphoma? He said, it sure looks like it. There's a 95% chance it is. I'm going to say it is. But we sent the biopsy off, and we'll have it checked, and we'll let you know. A few days later, I went into the doctor's office for the results, and he said, I got good news and I got bad news. It is not lymphoma. I said, well, that is good news. That's great. That's a form of cancer I don't want anyway. So he said, you have Graves' disease. He don't use the term Graves' disease. He calls it a thyroid eye disease. They don't like to single it out. But anyway, I'm having the trouble with my eyes where one eye is pointing one direction and one's pointing the other one. The thickening, I don't know how to explain it, the nerve of your eye gets real thick and it doesn't function properly. I've seen pictures on YouTube since I learned about this. I never heard about this disease before. Some people's eyes are completely turned crossed or point down. What they got me scheduled to do now is go in for radiation treatments. I don't know if it'll shrink up some tissue or what it's going to do, but I got radiation treatments lined up. Well, that doctor called me back and said they had to put me off 2 weeks. So I just continued taking my medication. But pretty soon I'll be going in for radiation treatments. And then I'll just be in kind of limbo after that. There's a possibility I could wind up having more surgery on my eyes if it gets worse. But I asked the doctor, he's got me taking prednisone, and I read the side effects of prednisone. It can damage your liver and do some other things. I said, wait a minute now, what's it going to do to my liver? He said, what do you want to take a chance on that or go blind? I'm trying to keep you from going blind. I said, no, I'm not going to argue with you there. I don't want to go blind. One of my wife's friends' husband has Graves' disease, and he's practically totally blind now. But it's kind of strange. I would come down with an ailment I never heard of before. I've been to other doctors since this all started. They told me to go to my regular internal people. They did a heart scan, did the electrocardiogram or whatever, and that came out pretty good. There was no problems there. And I already know I pretty strongly suspected I had emphysema because I've smoked for 50 years. Only recently quit. Right now I've been doing a little vaping, and that's a far cry better than smoking cigarettes. But after 50 years, I knew I would have some emphysema. And they said, yeah, I do have emphysema. But anyway, we got out shopping today. This is my third day in a row of being out of the house. I had a good old time following the wife around Sam's Club down here, buying a bunch of groceries herself, driving around one of them electric grocery buggies. We went to Walmart the other day, and I made the mistake of trying to walk around the Walmart. And when you got one eye pointing the other direction and you see double, it's real easy to lose your balance, especially when you're on medication. A couple times I like to fell down. Told my wife there today, I said, from now on, when we go grocery shopping or anywhere, I'm going to follow you around like a pet dog with one of these electric buggies. I'll never walk again. She kind of laughed. I know a lot of my viewers have been concerned and asking me different questions. That's the purpose in today's vlog, is just to basically let them know what the situation was. I have an appointment Monday with an endocrinologist, and he'll probably send me from there over to the radiation doctor. I'm not sure when that'll get done. But I appreciate my viewers' support and watching my videos and stuff, and I'll try to keep you up. I'll try to keep you informed in upcoming blogs for those interested. I fully intend to continue producing my videos here on YouTube, just as long as I can continue to focus my eyes on this computer. Right now I've been sitting here editing for quite a while, and I got to go rest my eyes. But I appreciate you listening. This is Walter, signing out for today. Thank you.